Thursday, March the 5th, 2020, the National Institute for Communicable Diseases confirmed that a suspected case of COVID-19 had tested positive. The patient was a 38-year-old male who travelled to Italy with his wife. So, exactly a year ago today, South Africa recorded its first COVID-19 case. But the pandemic had spread to Africa about 3 weeks earlier, on the 14th of February in Egypt, the country having had the first confirmation. Since then, nearly 4 million people have tested positive for the virus across the continent, with 105,165 deaths recorded. There is new hope, though, in fighting the disease, as the Africa CDC says in the next coming days, 20 African countries will roll out their vaccine programs through the Africa Vaccine Acquisition Task Team, which was established by the African Union. Well, to tell us more about Africa's COVID-19 journey a year on, I spoke to a public health expert who's a technical officer at the World Health Organization's regional office, and that is Dr. Mary Stephen.
A year like we have never seen before. We started with a lot of uncertainties at the beginning of the outbreak. The issue of dictation of the cases, our capacity to test, preventive measures, how the virus is transmitted, so many unknowns at the beginning of the outbreak. But in the course of the response, we have definitely come a long way. We have learned a lot of lessons. Now we are at a stage where we can see a very bright light at the end of the tunnel. Developments in terms of vaccine, we can do testing, genetic sequencing. We understand better the transmission of the virus. So quite a lot of things, the preventive measures as well, it is clearer for us now. So we have definitely come a very, very long way in this past year with regards to this COVID-19 response.
When we go back to that time, I guess it was no longer a question of if, but more when the virus would arrive on the continent. With that in mind, what kind of preparations as the WHO and health systems on the continent were starting to be put in place?
Yes, so as early as January, when the outbreak was dictated and reported to WHO and declared a public health emergency of international concern, as WHO, we started preparing the countries in Africa, trying to understand their readiness capacity for dictation and ability to mount an effective response for the COVID-19, knowing fully well that we are living in a globalized world where travel has been made easy. So we knew that, yes, Africa is very much at high risk of importation of this COVID-19 virus into the continent. So we assess most of the pillars of response for COVID-19. And we saw that the region had some strength in some of the areas, but we had gaps, especially in areas of infection prevention and control, the case management, the issue of laboratory, given that this is a new disease. Some of the areas are a bit better, capacities for points of entry, for instance, because we've been responding to Ebola virus disease. So we had something in place, surveillance, we had some, but others were much more of a big challenge. So we use that assessment as a background to start providing targeted support to countries to help them prepare to receive the first case and mount an effective response. So we did that capacity building. We deployed more than 200 experts to the countries for the readiness. And this came in handy when the country started having their initial cases. These same experts helped to support countries to initiate this response, building capacity for laboratory testing, expanding surveillance. So we did all that before Africa started receiving the first case.
And I guess that the entire health system on the continent was tested but it was a good test because it gave us an indication of our vulnerabilities and perhaps set us up in terms of health journeys beyond COVID-19 going forward.
Yes, even before COVID, we knew that the system in Africa is not as strong compared to what you find in other parts of the world. Yes, this COVID-19 was a very big test for us on the continent. Although we didn't have the high number of cases seen in other parts of the world, but we still had our systems in a lot of countries being overstretched because of this COVID-19 outbreak. Like I said earlier, it's an outbreak like no other. We haven't seen this kind of scale of outbreaks before. So there were lots of challenges that the health system faced, and they had to readjust to manage so they can cope with this challenge of COVID-19. Definitely, the system has been tested and tried, and we know where to fix going forward.
Why do you think that we didn't get as big a problem on the continent as other continents? I mean, when we look at Europe and countries like Italy and France and the United Kingdom, for some reason, Africa seemed to have much less of a first wave than some of these other continents and countries.
Yes, both first wave, even the second wave, their peaks are higher than ours. From the beginning of the outbreak, there is something that is important when you're dealing with emergencies: your ability to initiate response as early as possible. This is very, very important in how the outbreak will evolve, and then how you can contain or prevent further spread of the outbreak. So this was helpful for countries in Africa because they started initiating action early on, including the famous implementation of lockdowns, travel restrictions. Africa was one of the continents that was very, very, that was implementing some of those very stringent measures. Even some countries, with the first case, they started closing their borders. Thirdly, the issue of previous response to outbreaks as well. Yes, our systems are weak, but Africa is a continent that is affected by a lot of outbreaks year in, year out, big outbreaks. We still remember the 2014 outbreak in West Africa, Ebola, the 2016 outbreak of yellow fever in Angola and DRC, the 2018 outbreak of Ebola in DRC, so many large outbreaks that the countries have responded to in recent years. So this also contributed to the ability of countries in Africa to mount initial effective response to the COVID and curb further spread of the outbreak compared to other countries around the world.
So we had challenges in terms of resources, health facilities, but we managed somehow. And I just wonder as well, did we have enough skills, enough doctors, enough nurses on the ground to manage this pandemic?
Okay, this is a tricky question. We have seen how the systems across the world, including human resource capacity, was overstretched at the beginning of the outbreak. Yes, we are limited in terms of human resource capacity, but countries in Africa manage for some reasons. First, we were able to limit the number of people that could require admissions, for instance. Less cases, lesser number of people that would require attention in the hospitals, ICU capacities. So despite the fact that those capacities are still limited on the continent, especially in the first wave of the outbreak, we managed. Secondly, we had an advantage because we have a younger population, and the majority of these severe cases tend to affect people older. So this was also another advantage for us. Then we saw countries bringing in innovative ways of expanding these capacities of the health system. establishing temporary treatment centers and facilities for COVID cases specifically, and also bringing in health workers, different cadres of health workers, some that have retired, some that are still in training, to bring them together so they can complement the additional health workers that were required. So some of those innovative approaches were also helpful in addressing the need of the pandemic.
Talking about innovations, our continent is well known for traditional medicines and alternative medicines. This became an issue on this journey in terms of treatment and dealing with this. As a WHO and trying to manage this, I guess it was a challenge, to check efficacy and guide people on what to use and how to use it, given the fearful environment that we found ourselves in.
Yes, at the beginning of the outbreak, this was one of the big challenges, really, that we faced in Africa. Traditional medicines and lots of claims of effectiveness of these medicines without subjecting it to clinical trials. So this was a big challenge. But we also deal traditionally on the continent with the issues of traditional medicine. We have a unit here at the regional office that deals with that. So that unit was actually activated to expand their reach to all the different claims for COVID, to engage them, so to help them go through the clinical practices or clinical trials of subjecting these traditional medicines for COVID-19 potential use. But so far, we haven't found one traditional medicine that is effective yet against COVID-19.
All right. We saw some governments actually buying up some medicines from as far as Madagascar. Talking about countries and their different responses, are you concerned that some countries perhaps are still not applying the science? I'm thinking of Tanzania here, for example, who stopped even sending in data about COVID-19. And you hear the president talking about leaving it in the hands of God.
There are lots of dynamics with this COVID-19 outbreak, and of course, lots of challenges. So these are some of the issues that both government and public health authorities have to deal with, and they continue to deal with, engaging government to advocate for use of science for this COVID-19, because one country cannot be safe without the others. If you leave one behind, it would kind of drag us backward in terms of the response. We are not safe until all of us are safe. And so the importance of engaging all these countries and advocating for the use of science to guide their response for COVID-19. So nobody is against prayers, but let's combine it with the science so that we are doing our part as human beings as best as we know, as with regards to science, and then they can employ whatever additional things they believe in. But first of all, let's consider the science, and knowing that we have a responsibility to the rest of Africa as well, given that we are living in a world that is interconnected. So it's difficult to leave one country behind and then efforts in other countries. At the end of the day, it might kind of drag the effort backwards. So we need advocacy from all countries to make sure that everybody is using science.
And talking about using science, I guess, as you've said at the beginning, we've learned so much more about this virus. Vaccines have started, the rollouts, but in the interim, there's still so much we still have to do. In the end, which are the most effective practices? We started to use masks. I think we've always washed our hands. But over time, what have you found as the things that we must do regularly to make sure that we manage this pandemic before the vaccines actually get to each individual arm?
Yes, so from the beginning of the outbreak, we've been advocating that this is a whole government, whole society approach. And there is no one single measure that is effective. It's a combination of measures that all countries need to put in place with responsibilities from all of us as part of the general population. So as government putting measures in place to detect, to test, and to treat these cases, there is also a responsibility on the part of the general population to make sure that we are adhering to the preventive measures. We have to continue to wear our face masks, keep our distance away from others, avoid unnecessary mass gathering, making sure that we are washing our hands regularly. These are simple public health measures, but we have seen that they are effective. Even with this COVID-19 response, we have used some of these measures before, apart from the face masks for Ebola outbreak response, and we know that they do work. They also work for the COVID-19 response. Even with the vaccine, we have to continue to adhere to the preventive measures because the outbreak is not going to go away within a twinkle of an eye. It's going to take some time for us to get to that level of herd immunity, to the interruption of the transmission, and then controlling the outbreak at the end of the day. So we have, even with the vaccines, we have to continue to adhere to these preventive measures. So it is not the responsibility of government alone. Everyone has a role to play in it.
Do you see a third wave on the horizon?
That's an interesting question. A third wave is a possibility, but we have a very good opportunity, especially now that vaccines are being rolled out in countries around the world. So we can actually prevent the third wave by our efforts. So the effective public health measures, so the surveillance, the testing, treatment of cases, as well as the preventive measures we talked about, are very, very important in limiting the spread of the virus. And the vaccine, when it comes to the countries, the general population, please, it is part of our responsibility to also get the vaccines so we can contribute to interrupting the transmission of this outbreak at the end of the day.
One of the things that we've seen in the last few months in particular has been the emergence of variants with this genome sequencing. South Africa certainly was one of the ones that got painted with a new variant. Have you seen other variants across the continent? Or has it been limited in its geography to Southern Africa? Because we now know that Zimbabwe, for example, the variant that was first seen in South Africa has become dominant there as well.
Yes, so with viruses, it is normal to see variants. When viruses circulate within the human population, they tend to mutate. So variants will come. Now they attack variants of interest. So there has been a lot of variants circulating globally, but also in Africa, we also need to do more to test, to do genetic sequencing for countries so that we know not just variants imported, but also potential new variants that could be circulating within the population in a given country. So this is important for all of us and for all countries so that we can continue to track how these variants are evolving and find a way of curbing the spread of the virus.
We haven't tested as much as we would have liked to, I guess, but in the end, perhaps one of our best measures has been the number of people coming through to the hospitals and being treated at hospitals. Do you think that that's enough then in the end, that we've seen those admissions, the hospital admissions dropping and the fatality rates dropping, that we had enough information to manage the virus, even though it would have been nice to know just how big the problem was in the first instance?
Yes, laboratory testing has been a problem for us on the continent and also globally. This is because this is the first time we are seeing a virus affecting all countries in the world. We are going to the same global market to access all the laboratory reagents for testing. So yes, the challenge in Africa, we have talked about it. So we were limited in terms of the capacity to expand our testing on the continent. So countries had to decide on their testing strategy, what works well for them. So you don't find yourself in a situation where you have a sick person and you are unable to test. So yes, we manage with limited number of people going for admission. Like I said earlier, we have a younger population, and also the spread was not that much as we saw on the other parts of the world. So the number of people that came to hospitals in Africa was limited. We were able to manage with the limited resources we have on the continent. So it is good news as well to see number of cases dropping, but please let's not lower our guard. Let's continue to implement these measures that we know are effective so that we don't find ourselves in the third wave. So let's aim at preventing it.
The Africa CDC says that in the next 20 days or so, the coming days, 20 African countries will be rolling out their vaccine, which is great news. And I suppose the COVAX facility has really been a great help because many nations on this continent probably would have struggled to get these vaccines.
Yes, so for the COVAX vaccine, it has been rolled out already in countries in Africa. Ghana was the first country to receive the vaccine under COVAX. Now we have 11 countries have received already, and then we have additional countries, about 5 or 6, that are going to receive today, the COVAX facility. But definitely the vaccine from Africa CDC will help to boost the number of vaccines and expand that amount of vaccines that countries would use to vaccinate their population. So for the COVAX now, countries are focusing on priority populations, health workers, the elderly, and when we receive additional vaccine, of course, they will expand to the general population.
Do you think you're starting to win the battle in terms of vaccine hesitancy, or is there still much work to be done?
For vaccine hesitancy, we know from history in Africa, we've been doing vaccinations, popular vaccines, measles, polio, meningitis. But we need to do a lot of engagement, especially with the COVID-19 vaccines. There has been a lot of misinformation, rumors. So we need to make sure that the population is engaged. They know at least basic information about the vaccine, about the safety, the efficacy, so that they can be confident to come out for this vaccination. So yes, we have experience with vaccination before, but a continuous engagement of the community is important to avoid the issue of vaccine hesitancy.
All right, and perhaps as we start to wrap up and look at the future, the vaccines are here, they're being rolled out, and I just wonder what are likely the next milestones, and how long is the rest of this journey, perhaps to that point where we say we're sort of back to the old normal?
This is difficult to say really how long, but we know that so far a significant progress has been made with regards to this COVID-19 response. Getting an effective vaccine in less than 1 year is phenomenal and very, very good news for us, because if you look at Ebola virus, for instance, dictated since 70s, the only time that the first set of vaccines started rolling out was during the 2014 Ebola outbreak. So you can see the stark difference between it and the COVID-19. So yes, the vaccine is good. Let's continue to roll it out, but not forgetting that we need to build back better. Let the next outbreak meet us at a better preparedness state. So let's leverage the opportunity of this COVID-19 outbreak to continue to build on our systems and invest in our emergency preparedness. So we have seen what has worked. We have seen what is not working. So we need to focus on expanding those and getting ready for the next outbreak, especially the issues of policies as well, where we need to expand, where we need to update our policies that are out of date. We need to do that. Of course, basic things, the surveillance capacity, the capacity for laboratory testing, the capacity for treatment and expanding capacity to treat, the issue of strengthening of our health system, including the health workforce. They are all very, very important in making sure that for the next outbreak or pandemic, we are in a better place than we were when we had the COVID-19 outbreak.